My dear colleagues, my name is Thomas Frese. I'm the president-elect of WONCA Europe, and it's an honor for me and a real pleasure to welcome you for our today's event as a webinar. We have more than 100 people registered, some already joined, some are still coming in. Today's talks are about a very important topic, a topic which unfortunately our colleagues and the primary care family from Turkey was confronted with. It is about disaster management strategies of the Ministry of Health of the Republic of Turkey after the earthquakes on the 6th of February in 2023. A huge catastrophe which had a hard impact on the local and regional populations, but which had also had a very high impact on the primary healthcare providers and on us as family physicians. We have two speakers today. The first one is Süleyman Özsarı. He was born in 1981. He had many functions during the past years of his career. Started initially, if I get it correctly, in the Navy of the Turkish Armed Forces. He served as the Deputy Director General of Public Health at the Ministry of Health between August 2022 and 2024. He is currently a faculty member at the Department of Family Medicine at the Faculty of Medicine at Boland Baysal University. He's also quite active in the field of science related to primary care. He will give now the first talk. We will have discussions and questions after the two talks, and you're cordially invited to bring forward your questions through the Q&A sessions you see here down at the bottom line of the Zoom. So first, Süleyman, a warm welcome from my side. We are happy and honored to have you here. The floor is yours.
Thank you very much. Thank you, Mr. Chair. I extend my respectful greetings to all participants attending these events. Following the big earthquake disaster we experienced in February 2023, I served as coordinator and manager in the earthquake zone on behalf of the Minister of Health for over a month. During this time, I had witnessed and experienced many situations firsthand. I would like to express my gratitude to administrators, to WONCA European and the organization committee for giving to me opportunity to share the experience I gained during this devastation earthquake. I also wish to extend to my special thanks for our presence, Professor Dr. Özsarı Öztürk, who represents family special in Turkey, and Professor Burcu Kayan Tetik and specialist Dr. Ali Öztürk for their support. Within the time allocated to me, I will discuss the main aspect of the disasters we experienced and the primary healthcare service provided in this aftermath. In the final section, I will present the key challenges we encountered, examples of good practicals and my recommendations for solutions in the futures. With your permission, I would like to begin my presentation. Thank you. Recent disasters have shown that even the most developed countries are vulnerable against national disasters. It seems to be like national disasters will remain the threat in global community and impact the development of the countries. Each country should be prepared by having a national and regional emergency response plans, by having a plans for empowering local communities, by educating social aid staff By educating healthcare professionals on some certain cases and diseases during the disasters, by defining the process of the primary care services and healthcare administrations, by building laydown areas and managing to hard process on the inventory, by strengthening national surveillance systems for primary care diagnosis, treatment, and sanitation, and establishment of protocols for health information management. All countries must be prepared at the highest level for any disaster they may face. Earthquake map of Turkey. Turkey is located on the Alpine Himalayan belt, which is one of the most important earthquake zones in the world. The area has many active faults due to its complexity of geological structure and geodynamic location. As a result of the 7.7 magnitude Kahramanmaraş earthquakes with the epicenter in Pazarcık and the 7.6 magnitude earthquake with the epicenter in Elbistan on February 6, 2023, approximately 14 million people were affected in 11 provinces. During the earthquake, 50,000 people lost their lives and more than 100,000 were injured. A level 4 international disaster declaration was issued, calling for national and international assistance. We faced a rare disaster that has been occurred only a few times in the world. The earthquake also seriously affected our health system and health infrastructure. Despite all the difficulties, all the available capacity of our countries was immediately directed to the earthquake region. We work with the great devotion to provide all the health services our disaster-affected citizens needed. This is one of our most significant healthcare achievements activities. Primary health care service role fluently since the first minutes of these earthquake disasters, and the importance and the effectiveness of primary care have gradually increases, and especially within the formation of temporary settlements. According to the damage assessment data caused by the earthquake, a total of 42 hospital buildings in the region, 27 belonging to Ministry of Health, 6 belonging to universities, 9 belonging to private sector, were severely and moderately damaged. Considering the building and material situations, the total damage in the earthquake region throughout the health sector to $4.3 billion. Considering the need for health services provision in the provinces that received the migration due to earthquake, it is estimated that total need in the health sector will be approximately $6.7 million. More than 26,000 people, including doctors and medical personnel, were assigned to health facilities in the earthquake zone in the first months. It caused a significant portion of the country's economy, and manpower be transferred to earthquake zone. This situation will continue for many years. After the earthquake, civil action that was taken to ensure the continuity of preventive health service, and measures were initiated to address potential emerging health issues. I will discuss some of this. Children and infant follow-ups. In addition, the health services provided the sick and injured kids, which screening in the earthquake region was started. 2.7 million examinations were carried out. Baby child monitoring services were re-engineered according to infrastructure affected by the earthquake and were quickly put into operation. 2.3 million baby child monitoring was carried out. Infection diseases vaccination campaign was started in all the cities affected by the earthquakes. Within the first week on the earthquake, tetanus vaccination was given to all personnel working in the debris areas and the injured people rescued from them. Within the scope of the expanded immunization programs, infant and childhood vaccination were administered. The fight against infectious diseases in a large area also prevented the emergence of a large-scale epidemics. The other is the pregnant woman. Minister of Health contact directly with the pregnant woman in the risk group and with pregnant woman whose family works in the earthquake were in last trimester. Pregnant women in the risk group were reacted immediately, considering the urgency in the order to provide them health care in the earthquake area, and also if they move outside of the area. In the first 10 days, more than 10,000 of pregnant women were called. At least half of them were contacted. Pregnant and purple follow-ups in the provinces where earthquakes occurred were followed daily through electronic systems. Within the same dates, a total of 7,000 pregnant women and more than 600,000 purple women were monitored in 11 provinces where earthquakes occurred. Maternal and child health, as a part of the preventive health services provided in the primary level in the earthquake-affected region, efforts were made to protect maternal and child health. In order to protect maternal and child health with the scope of preventive health services provided at primary level in the earthquake region. A follow-up to women between 15 and 49. Establishment for pregnant purple women were done. Pregnant women continue to be provided with the reproductive health constancy service in the pregnancy information class. Babies and women who are the special groups were given the proper priority throughout the disasters. The other important area, drinking water and environmental health teams carry out studies to determine the usability network systems for drinking water control and safety. Daily chlorine the measurement and supplement were carried out and residual chlorine measurement was carried out. The water was first made usable, then the drinkable. Environmental health, infection diseases surveillance studies were continued taking into the account of the risk factors. Field controls were carried out for vectors and rodents. Solids and medical wastes were put under the control. The other area is screening the people who were reported positive and suspicious in the earthquake cancer screenings were called by phone, and they were informed about the results and they were directed to the relevant places to prevent delays in the later stages of the earthquake. Environmental health services and screening services will be continued uninterruptedly and more strongly throughout the disasters. Psychosocial supports and constancy. Psychosocial support services were provided in the field with the support of 400 doctors with the Minister of Family and Social Politicals. People affected by earthquake were visited by 55 teams and psychiatric services were provided. With the support of the voluntary physical mental health services provided to children and adolescents who were affected by the earthquake. These support services were collected as data with a web-based system, collect special children support system. Psychosocial support services were provided in the disaster area by the Department of Mental Health of the Minister of field. It was very important to keep the mental state of the people who had survived a big earthquake and medical staff working there strong. Field of primary healthcare service in the earthquake area could be coordination and communications, service buildings and sheltering, service primary healthcare, water sanitation, hygiene and environmental health, data management, logistics and supply content. So here are some of the problems, practical and suggesting I say. The one problem of coordination and communications within the scope of general coordination, the lack of the adequate planning the primary care and prevent health services within the pre-earthquake action plans emerged as a problem. Our practical, as an example of a good practical, considering the geographical distance, supports provinces were quickly determined and sent to earthquake zone according to the proximity from the surrounding provinces of the earthquake zone, thus preventing delays. Our suggestion is that in actions plans made before disasters, it is our recommendation that central public health teams be planned and coordinated according to the size of the disasters. And the other problem within the scope of the coordination of public health services, communication problems occurred between the provincial administrators and the central health administrations. Then a crisis that was quickly established within the Ministry of Health, enabling information be managed from a single center. To avoid, our suggestion is that to avoid such problems, developing the separate public health action plan before the earthquake and creating an emergent coordination scheme can eliminate the communication and coordination confusion after the disasters. It is important that the emergent coordination scheme has alternatives. In the case where people cannot be reached, the second person to be contacted will be identified. Coordination of health services provided in the earthquake zone was most important point all of the actions, I think. Other service buildings and shelterings have a problem within the scope of service buildings. It was stated that where difficulty regarding where service would be provided due to extinct service buildings being affected by the earthquake. In addition to accommodation problems have arisen for healthcare workers who they are coming from outside. We moderately and severely damaged primary health care facilities which could not provide services were matched with the nearest healthy facilities to ensure continuity of services. In the tent cities and container cities created, 4 containers were planned, 2 for examination services and 2 for the accommodation of healthcare professionals, with 1 physical per 1,000 containers. It was calculated that a container accommodated 4 people. These containers were placed in areas accessible to everyone in the accommodation centers. Suggesting it is necessary to quickly assess the damage as soon as possible after the disasters, to start with the buildings that provide health services, to plan alternative models for the housing problem in the advance, to determine the place with the low earthquake risk with the relevant public institution, to start the reconstruction of health institutions. As permanent housing was moved on planning for primary healthcare buildings began. The problems within the scope of manpower, the insufficiency of personal training in disasters management causes difficulties in service delivery. One of the online training meetings were held for healthcare professionals working in the field on mental health. So providing in-service training within the scope of disaster preparations. These trainings need to be repeated and the information must be kept up to date. Service delivery another problem while assigning personnel to the disasters area. Difficulties were experienced in the planning of task distributions of the assignments process. Family medicine specialists and public health specialists were assigned from the outside the earthquake zone to provide primary health care service temporary shelters. All tents were visited and household members were identified. Interventions were made regarding infection diseases, vaccination, and environmental health problems. The reports were reported to upper units. The term of that of the assigned health personnel was limited to weeks. Later, they were replaced a new team, and an attempt was made to reduce the physical and mental wear of the personnel. Post-disaster services delivery distribution and as a segment duration need to be planned according to disasters of different size and variates. The primary health services or immigrants support financed by the European Union SAT project. Some of you know this project have been interrupted. There was been international migration movement. The capacity of our practical is the capacity of immigrant health centers in the surrounding provinces receiving immigrants have been increased and support has been provided by personnel who speak the language, same language. The immigrant health center employees in the earthquake region have been assigned to temporary shelters where immigrants are mostly located. Immigrants have been included the general health planning after the earthquake. Our suggesting health services provided to the immigration population should be kept electronically and data should be integrated into the general health system. In this way, screening, vaccination, and infection diseases follow-ups will be easier. In the service, the other problem within the scope of service provisions, preventive health services provided before the earthquake were interrupted. In order to ensure the continuity of service of citizens receiving services before the disasters and to prevent possible negative situations that may arise due to delays, studies were carried out to complete unfinished work and produced in the light of the data. For example, before the disasters, the cancer screening results of those receiving cancer screening service from disaster area health institutions were questioned, and necessary follow-up and referral studies were carried out by ranging the positive and suspicious cases, primary muscular atrophy and thalassemia screenings and newborn screenings in the funds were continue. Suggesting in order for preventive health services not be interrupted during the disasters, central laboratory services should be strengthened and vehicular supports should be provided for the transportation of samples. The other important problems, there have been problems in the providing health service to rural areas. The immigration from the center to rural areas after the earthquake has increased the need for health services in rural areas. Mobile teams have been established to overcome problems such as transformation difficulties and personnel shortages. With daily planning, examination, vaccination, and environmental health services have been provided by mobile teams on certain routes. Suggesting about this material and vehicle sports should be provided to mobile teams and the routes should be planned from a single source. Important problems in service delivery. There was a difficulty in providing the clean usable water. And environmental health technicians are assigned from the neighboring provinces. A mobile water analysis laboratory was established. The points where water samples were taken for analysis were increased. and daily monitoring was carried out. Chlorination of water supply to temporary shelters was carried out. Super chlorination of tanks providing water to the region was carried out. Our suggesting in a way that will be also cover the pre-disasters period. Active such workshops on the water should be carried out to remind all the relevant stakeholders, especially local governments, of their responsibilities. It was suggested that the post-disasters revival works be carried out in the coordination with the Minister of Health in terms of water safety, environmental safety, and chemicals. The other problems, there were difficulties in reaching babies, children, and pregnant women during earthquakes. After the earthquake, households in the temporary shelters were visited by one by priority groups were determined. The vaccination of babies and children whose vaccination time came and were done on site with the mobile teams and recorded the electronic records. The information of earthquake victims who went to neighboring provinces was made available to all family physicals, whose health follow-ups were facilitated. I was suggesting in this area, preparing units to provide primary health care services during the disasters. It is accommodated to establish women's and children's health follow-up units during the disasters. Keeping health records complete facilitates post-disaster uses. It was not enough to simply straighten the primary care services in the earthquake zone. At the same time, the capacity of the surrounding provinces that received migration were also expanded. It's important data management. Data management have a problem. There have been problems with the manual recording keeping within the scope of data management. We transfer the manually kept forms to the electronic media has been stated as a good practicals, says. Suggesting as a forward-looking solution, suggesting in order to transfer all health services provided or planned in the temporary shelters, paint, registration, examination, infections, diseases monitoring, pregnancy, baby child monitoring, water analysis, vaccination, the other to electronic media and to be reported as desired. Offline system should be developed and plans should be made with the relevant institutions to provide energy to the region quickly. In terms of data source, it has been reported that the area problems with information deficiency due to inability of obtain information about temporary shelters areas. The communications problem has been particularly overcome with daily reporting made with health workers assigned to shelter centers. Vaccination availability levels have been monitored daily with the which take the device provided in the field. It is important to determine the priority data areas to be used in the event of disasters and to prioritize stations that require instant information flow, such as infection disease monitoring. Unless we can get accurate data from the field, it is difficult to understand whether the service we provide are sufficient and appropriate. Therefore, keeping records regularly and communication are important. Logistics and supply. The problem within the scope of mobile vehicles due to large size of the mobile laboratory light truck used in the earthquake, the limited mobility and provision of mobile vehicles have become the challenge. Our practicals, the Minister of Health sent a mobile laboratory to the earthquake zone, and vehicles from the surrounding provinces were planned for the earthquake provinces for mobile health services. As a solution of this issue, it would be appropriate to increase the mobile capacity and number of vehicles provide load carrying vehicles, purpose mobile vehicles for the teams providing primary health services. Immunization threatens mental health to use in disaster situations and cooperate with the other institutions in logistics. The other problem in logistics and supply, it has been observed that there are the coordination problems in the distribution of vaccinations within the province. It has been stated that the vaccinated transport vehicles and containers were damaged. In this context, the prefabricated vaccinated warehouse were established in the order to stock medicine and other materials and to distribute them easily. The post-vaccine warehouses were strangulated and their capacity was increased. Vaccinating transportation for provided from the center according to the need. The cold chain was established and monitored. It is true that it would be beneficial to build earthquake resistance warehouses and carry out logistics and stocks management and determine the backup vaccine and cold chain areas and make the necessary emergency plans. The provision of necessary materials and their safe delivery to the required place at the time when the transportation was limited show us how important it was be multi-center earthquake. The last other services, the Minister of Health has established a website to provide the accurate to up-to-date information about the earthquake. On this page, you can find many information, brochures, quizzes, and posts about earthquakes. Here are some of them I want to show you. A brochure covering two important topics: chronic diseases and safe use of water, chai, health, and breast milk in the earthquake zone. Two brochures. The other brochures are PICE and environmental health and hygiene issues, disinfection of water, individual water supply, and personal hygiene in the disasters. A brochure on two of the major problems we have faced in the temporary accommodation centers, CAPIAS and TRAPIAS. It is important to be. The other brochures, the breastfeeding in the period of the disasters and emergence. You see. In addition to trying to prevent national disasters, we need to learn to live with them. A strong and prepared primary care system help us get through disasters with minimal suffering. And I offer my condolences for the flood disasters in Spain. I hope the same pain will not be experienced again. Then, no matter what nation we come from, our pain is the common. Thank you for listening to me. Please excuse me if I made any mistakes. If you have any questions, you can write to me via my email address in this page. Thank you again.
So, Süleyman, thank you very much for this interesting talk. As I said, we are trying to collect the questions also during the second talk and then go into discussions and into answering the questions. By the way, as I notice, it seems that many of the colleagues are from Turkey. So please feel encouraged. You can also type questions in Turkish language into the Q&A. The presenters can reply and can provide also a brief summary of the question to those who do not speak Turkish. But for now, I would like to come to the second speaker of today. It's Şule Gümüştakım. She's the head of the family the medicine department at Kahramanmaraş Zühtü İmam University Medical Faculty since 6 years already. She's also a specialized family doctor active in European networks like the European General Practitioners Research Network, EGPRN. She has had and currently has positions at SAHUT, at the International High Commission, where she was personally experienced by the earthquake in her region in 2023. And she's also quite active in the field of science related to family practice and published many articles. So Şule, a warm welcome for you, and the floor is yours.
Thank you very much, dear moderator. Good evening, dear colleagues and dear moderator. I am Associate Professor Raziye Şule Gümüştakım. And I would like to thank to WONCA Europe giving me the opportunity to talk on Turkey's recent earthquakes. And today I will share my experiences as a medical doctor and academic who experienced the earthquakes in Kahramanmaraş. My presentation consists of two parts, from a healthcare professional and academic perspective. Disasters, especially natural disasters, can be particularly challenging for academics and healthcare personnel because they are unprepared for these processes. Healthcare personnel who are earthquake victims can suddenly face a very serious workload. In such an unprepared period, healthcare personnel may have difficulties such as trying to help patients, relieving the same fears with the aftershocks that occur one after another, and coping with feelings of guilt because they cannot be with their families. In Kahramanmaraş, the epicenter of the earthquake, there were 126 family health centers and 407 family medicine units. Unfortunately, 6 family physicians and 7 family health workers lost their lives during the earthquake. The major assessments of outpatient settings were conducted by technical expert teams. Many family physicians were required to stay and work in various locations. Initially, some family physicians used their offices as temporary accommodations because they considered them safe in there. However, they were evacuated from their place once family physician services commenced. Family physicians and family health workers had rotations for their shifts during that time. Those without a place to stay were traveling back and forth from out of the province. On the 5th day, 12 family health centers, FHCs, were active. On the 12th day, this number increased to 38, and by the end of the first month, 96 FHCs were operational. In areas where FHCs were not active, health services continued to be provided through tents, containers, and mobile teams in the affected quake zone. By the 2nd and 3rd months following the earthquake, most personnel affected by the disaster were working in FHCs, and the number of external assignments had also declined by this way. Tent cities have transitioned to container cities, where primary care services were carrying on the operation. Currently, there are 123 FHCs providing service, with 21 of them operating from container facilities. Although the number of FHCs has decreased, the overall number of service units have been maintained through the merger of FHCs. During this period, there were no warnings of cold chain breaks in the FHC vaccine tracking system or in manual record keeping. However, due to prolonged power outages in our province after the earthquake, the vaccines held by FHCs could not be used or recorded as decided by the Provincial Health Directorate. In March, vaccine shipments began in response to requests from our region, and vaccination procedures were resumed at the FHCs. In terms of academics, The education and thesis of residents and students are disrupted in such a chaotic environment. However, the deadlines are extended. While life continues in the rest of the world, articles were being published and people were rushing into different trainings, while everything stopped in the disaster area. The time was spared for meeting with the humanitarian needs only. We were at the hospital with our team and as well as the professors just from the beginning after the earthquake. Since other regional hospitals were also damaged, we were almost the only healthcare institution providing services in the area. Although we were located in a region where an earthquake was expected, we were caught off guard and unprepared. The earthquake was extremely strong and impacted 11 provinces, which contributed significantly to the chaotic situation. Unfortunately, no help could come from neighboring provinces as they were also affected. At our hospital, patient beds were set up in the corridors due to overflow. Some staff members who were affected by the earthquake were unable to reach the upper floors because of the trauma they experienced. We dealt with constant aftershocks, most of which occurred while we were at the hospital. Fortunately, our hospital had a seismic isolator, which made it relatively safer compared to other buildings. Many professors and staff members chose to stay at the hospital because it was considered safer like heaven. Patients were quickly triaged and transported to other provinces by helicopters. The emergency department faced an overwhelming workload, especially since all the polyclinics in our hospital and even throughout the city were closed. 1 week after the earthquake, our department was asked to support the emergency green zone. The emergency green zone unit provides service in cases of minor injuries and illnesses. It's outpatient and stable general condition and stable vital signs. And care for the patients arriving at the polyclinic. We managed the emergency green zone for 2 months and 15 days until May, working alongside 3 academics and 26 residents from the family medicine department. As we had enough supplies at home but faced shortages at the hospital, we requested additional materials from TAHUD, it's our association, Turkish Association of Family Physicians, during this period. We had not stethoscope, we had not a sphygmomanometer or pulse oximeter or pens. Our residents did not have proper accommodations during their shifts, so our association provided containers for their use. Those days were incredibly difficult. There was no water and people could not even bathe. Patients of chronic conditions arriving at the emergency department were hesitant to seek help for themselves in order not to steal invaluable time and effort of the healthcare personnel who were already occupied with other patients already in need of medical or surgical emergency. This is the container that was sent to us by our association TAHUD and used by our residents. Our residents were staying in the container during their shifts. In addition, our residents whose houses were damaged in the earthquake were also using this container. It was winter and Kahramanmaraş was experiencing one of the coldest winters it had seen in years. Many cases of newly diagnosed or untreated pneumonia were observed, along with dermatological issues such as scabies and various hygiene-related problems. Additionally, several healthcare facilities were collapsed or damaged, preventing any health institution in the city from operating at full capacity. Unfortunately, the record-keeping of the daily routine patients during that time was inadequate. Despite our efforts to document symptoms, findings, and diagnosis on forms in the emergency department, a proper recording system could not be maintained due to the overwhelming intensity and systemic challenges we faced. During this period, our residents were unable to continue their rotations or receive necessary training. The residentship process was completely disrupted and thesis submissions were not possible. Even if a thesis topic was chosen, there was no available population to work with, as most people had moved to other cities already. Those who remained were living in tent cities or containers and were not in a good psychological state. It took a long time to recover from this situation. The sections of our hospital that were undergoing renovations faced additional challenges as we tried to regain motivation to resume education and address various issues. Despite the difficulties, we managed to send 2 residents who had completed their thesis to other cities as specialists after they passed their thesis and specialization exams. This was done to prevent delays in their assignments. Some of our residents went to medical schools in various cities to complete their rotations after a certain period of time. Our senior medical students were sent to medical schools in other cities to ensure that their education would not be disrupted too. For some time, we were unable to conduct undergraduate courses. Eventually, we transitioned to online teaching. It took a while before we could return to face-to-face education because there were no safe accommodations available for students or residents in the city. Overall, both as health personnel affected by the earthquake and as academic staff, we experienced significant exhaustion throughout this process. It has been about 2 years since the disaster we experienced, and during this time, we have made a significant recovery. Our residents are now able to go on their rotations and work on their thesis. The thesis topics assigned during this period have generally focused on earthquakes. Now we can finally address our pending academic work and write our articles. Despite the ongoing aftershocks that trigger our traumas, we, as academic health professionals who have intensely experienced PTSD, post-traumatic stress disorder, are striving to persevere and move forward. In this process, we have also learned valuable lessons along the way. Disaster management should be incorporated into the curricula of both residency programs and medical schools. Our residents and students need to engage in practical courses on this topic. When needed, we should seek support from organizations like AFAD, Disaster and Emergency Management Presidency, to facilitate these courses. Additionally, simulation training can be utilized to enhance learning in this area. Multidisciplinary training teams should be established and online courses should be offered to both family physicians and residents on how to respond effectively in disaster situations. These teams should consist of professionals from various fields, including psychiatry, child psychiatry, pediatrics, public health, emergency medicine, infectious disease, etc. A disaster management academy should be established. Here are the important topics for the disaster period I am listed here. Screening infants, children, and adolescents during disasters. The psychosocial effects of disasters on children. Screening chronic disease during disasters. Managing diabetes in disaster situations. Post-disaster vaccinations and adult immunizations, mental health challenges during disasters, skin issues following disasters, pregnancy and hygiene concerns after disasters, the importance of breast milk and breastfeeding during crisis, the impact of disasters on spatial populations, rational use of medications during emergencies. International collaborations and projects should be pursued on this topic. As academics from Kahramanmaraş who have directly experienced this situation, we are ready to do everything possible and engage in all forms of partnership. It's natural for us to forget experiences over time. However, we must not overlook these lessons. Instead, we should learn from them and integrate what we learn into our lives. Based on all these observations, I can say that in our country, which is located in a dangerous region in terms of earthquakes, we need to be more prepared for such situations individually and institutionally. I think that the experiences we learned from recent earthquakes should stimulate and update hospital disaster plans so that all personnel should be taught what and how to do in a possible situation like this one, and that the preparations should also be made in related state institutions that will lead to trainings at intervals regarding vaccines, clean water, hygiene, and infectious disease during disasters. Again, since we, as family physicians, receive psychiatry rotation, we need to be competent in this part as well. I think that training should be provided under the leadership of our association, WONCA and TAHUT, on the subjects of approaching the patient in the mourning process, approaching the individuals with PTSD, including a traumatized child patient. At the end, these photographs belong to our Family Medicine Symposium in Disaster Days that we organized with TAHUT at our university in Kahramanmaraş on October 5 and 6, 2024. In this symposium, we talked about important topics in disaster periods that I just mentioned. Thank you for your attention.
So thank you very much. It was a very interesting talk and brought up many relevant facts. By the way, I welcome our president of WONCA Europe, Shlomo Vinker. He's also here. Okay. Thinking about some questions. Süleyman, you mentioned, and I was surprised to hear that the pregnant women which are close to delivery were contacted. And I wondered from the German perspective, how did you manage this? How was this possible? Is there a kind of register in Turkey? You're still muted. Did you hear the question?
I take again the questions, please.
Yeah, I was wondering how you were able to contact the pregnant women which were close to delivery. Is there a kind of registry in Turkey, or how did you manage this?
Thank you. We're pregnant women, and it's important very groups. We tell to him because in the family medicines have their phone have in the agent. Some calls in the center of the ministry. We first 10 days more than 1,000 pregnant women we called. It is a very big number. We list all of them the contact. Half of them were contact, and they how they do in there. We want to be learning there. And 1,000,000 pregnant women, more than 6,000 prevalent women in 11 provinces earthquakes occur. We called in the ministry center, health ministry center, and it is very important to wear because the given priority throughout these babies and women who are special groups were given priority throughout the disasters.
Okay, thank you. It was mentioned in the questions and answers session about the mobile communication, and you stated that it was not interrupted for a long time, and that also satellite phones helped a lot. I would like to admit on this, that this is a real problem with the mobile communication, because most of the senders providing the network will maintain just a few hours before the blackout. So we are also planning in Germany how to keep this online in order not to have the full communication collapse. Professor Gümüştakım, during your talk, you indicated the numbers of primary healthcare facilities going back to work in the weeks after this disaster. But I would like to learn more about the first week, or let's say the first days, since there the number was quite low. How did you manage to provide patient care during that days? Was this just through the hospitals, or how could you manage?
It's difficult for us, and many of patients, and we have our shifts, and
so you did more, you did longer shifts?
Shifts, yes.
And
Night and days, and our residents and we academics, 3 academics, works shifts, a lot of patients, but we managed this situation. It's difficult. We have difficulties about medicines or illnesses, and pardon. After the branches, dermatology, psychiatry, and they help us.
okay.
And we consultate them.
Thomas,
Yeah.
I want to say something for the family medicines. If you give me
Yes.
such a major disaster remind us again of the importance of primary care and family medicine. Family physicians who know the local people and provide them with the one-on-one services are greater facilitated in connecting with the field. We especially provided health service to temporary shelters through family physicians. In this way, they were not separated from their populations. Family physicians will be defined to have an important role in the earthquake preparedness planning in the future, I think.
Yeah, I think thank you for this admission. It's very important. And really, we as the family physicians, we are there. But on the other hand, and this was also mentioned during our talks, it requires, let's say, you cannot say good because you're never prepared, but it requires some kind of preparation, having supplies ready to be delivered through a country, having facilities which are, let's say, resilient against disasters or other events, and also having some supplies and additional supplies regarding essential drugs. Yeah. Okay. So I do not see more questions in the questions and answers. So Shlomo, the word is to you for some discussion and maybe also for the closing if you want to.
So first of all, I want to apologize that I didn't listen to the entire webinar because I was in my way home and there were some delays in the train. But I want to share with you my personal experience. I've been in 2 missions for earthquakes, one in 2001, and it was in India, and the second 2010 in Haiti, in the Caribbeans. And I would say that at the first days, you don't understand what is the role of family doctors, but after several days, let's say more than 1 week, the most busiest doctors in our mission were family doctors, and the others actually helped us. So it's important to understand that even in areas of disaster after the first wave, we as family doctors have a very important role. And I really appreciate, I partially listened to you both, and I really appreciate what you did. And I know it is much more challenging to treat your own people than to come from outside. And because maybe you know some of the family, some of the members, you lost yourself, some of your beloved, so it's quite very emotional. But on the other hand, you are very filled with the task and with the mission, and I really appreciate it. So I want to thank you both for sharing your experience with us today. And I also call to other participants in this webinar, if you have some interesting experience that you want to share with us, or you have friends with special stories like this, and not always earthquakes, it could be something more less extreme. Please share it with us, and we will give you the stage on those webinars. So also thank you, Thomas, for moderating, and Burak, of course, for all the technical help.
Hey, so thank you all very much. Shlomo, thank you for joining. Thank you all the colleagues for joining and for discussing. Please keep transporting the messages and keep transporting your experiences. As Shlomo also said, WONCA Europe is happy to support whenever we can. Thank you all very much, and we are closing the webinar for today. Bye-bye.
Bye-bye. Good night.